The reason why I think prudent healthcare is important is because we are at the moment living in a time and an environment where we have to use resources sensibly, and we have to be willing to provide the best quality care possible to our patients, and we have to redesign our services so that the patient gets what they need in as best a way as possible, and that's often by building pathways and services around the patient themselves. The example I've got of prudent healthcare principles is a model we established in Cardiff and Vale, where we moved an adult hearing loss service, which was initially in the Univeristy Hospital of Wales. We see about 7,000 patients in that environment. So we've moved those 7,000 patients out to a GP practice in the Vale, and it's worked beautifully. The compliments and what's the right word? Accolades we've had for what we've done have been amazing. It's been humbling, actually. They now have a service that would have taken them an hour and a half round journey to the Heath Hospital. It would have often resulted in finding somewhere to park, then a journey, sometimes in a wheelchair, across a busy road, across a car park, into a very, very busy and disorientating hospital environment. Then they have to find their way to the outpatient department. Then they have to find that they need to come back again 3 days later for another part of the appointment. So they'd be making 2 or 3 journeys for something that now they can access on their own doorstep. I had what I would imagine, if you put it on a piece of paper, a very simple project that had tangible benefits that was evidence to anybody that chose to read them. But the structures in which I work and the systems in which I'm forced to live in don't recognise that. So it's really difficult. If you think you've got an idea, if you think you've got an innovation, then don't give in. You just have to keep pushing, because if you believe what you've got is worth doing, you'll win in the end.